I think it was with my fourth year API rotation. So in pharmacy school, we do different clinical rotations, and I did my first rotation at Lumicera and really enjoyed uh, the patient interactions. It was a different pharmacy experience than anything we had been exposed to in school so far. So just, yeah, being able to kind of talk with patients, not feeling rushed or anything like that, going over different like complex disease states. It was just, yeah, a unique kind of pharmacy setting that just, yeah, I really enjoyed and enjoyed the patient interactions. Yeah, so I'm on the clinical outcomes pharmacy team. So I work a lot with our manufacturer programs. So different kind of educational programs we have through the manufacturers to provide additional kind of support for patients, like starting on their medications, making sure things are going well as they start a new medication. So that's kind of one portion of my job as a clinical outcomes pharmacist. I also help with the creation and updates of our clinical programs. So the educational material that we go over with patients about their medications. So starting new with their like new enrollments, as well as like refill assessments. So we go through those and update the clinical information, make sure it's as up to date as possible for patients. I feel like in the specialty like setting, patients are pretty invested in their care. So we deal with a lot of like complex like disease states, and patients are wanting to know more or as much as possible. A lot of times they've already done kind of their own research on their medications. So they're, I'd say, kind of compared to like a retail setting, um, our patients are really kind of invested in their care. They know the medications that they're getting for their condition is helping them kind of either feel better, or for like our oncology patients, kind of treating um, difficult diagnoses with cancer. So they're pretty invested in their care. They want to be talking with us. They want to be finding out more about their medication. So yeah, I'd say like talking with our patients. Yeah, they're wanting to know more information. They ask really good questions, and if they aren't understanding, they aren't afraid to ask kind of more kind of follow-up questions. I think for us, it is like the patient care, putting the patient first. So yeah, not kind of having like restrictions or kind of making our clinicians feel pressured to kind of speed through things. I think that kind of makes things unique. I feel like when a patient calls us, they're always getting to a live person to be able to either set up their medication deliveries or speak with like a clinician if they do have any questions or concerns. And we try to get to those calls as soon as possible, so we're not leaving them waiting too long, and keeping things kind of convenient and, yeah, as easy and smooth as possible for them.